I think one of the things we might learn is some more details about their plans for distributing the vaccine when it comes out. They've built a sort of elaborate system for how they're going to allocate this to states and then how it's going to be distributed throughout the states, any resources that they'd be pushing out to the states. My guess is that he might address that. I don't know that there's any updates on the vaccines themselves beyond the news that we've gotten so far this week. So this might deal with how they're going to make the vaccines available when there is an emergency use authorization eventually for one or more of these vaccines.
Meantime, we're seeing cities and states and counties and going in different directions when it comes to partial restrictions, advisories like we got from Chicago, potentially closing of school in New York City. What do we need right now? Given the fact that there's not a ton of political appetite for a full shutdown, but cases are surging and hospitals are filling up, what do we need in terms of restrictions in this country?
Yeah, what you want to see is governors, cities trying to get ahead of the spread, because we know this builds very quickly. Once you have exponential spread, it starts to build very quickly. So we should be starting to take targeted mitigation steps right now, closing congregate settings, things like restaurants, bars, nightclubs, looking at how we're going to try to keep schools open through this, trying to put in place mask ordinances in cities and dense areas where you see spread building. All of the things that we know can reduce the scope of the spread, reduce the velocity of the spread. We should be doing those things right now to try to get ahead of it. Right now, if you look at what's happening, you look at hospitalizations, 67,000 people currently hospitalized for COVID. That's a record. That eclipses what we saw in the spring and then again in the summer. 13,000 people in ICU beds. There's about 55,000 medical ICU beds in this country, 100,000 beds if you count surgical intensive care unit beds and neurosurgical intensive care unit beds. So we're filling up our capacity in this nation right now. And I think that's going to be the biggest problem, is that we're not going to be able to create new beds like we were able to during the last waves of the infection, because this is so distributed around the country. You're not going to have extra healthcare personnel that you can move into a hot zone. Every place is going to be a hot zone. And that's really what we need to watch, is these beds starting to fill up. That's what's going to ultimately put pressure on the policymakers.
Dr. Gottlieb, is there evidence from Europe that partial lockdowns, as is being put in place there this fall, this winter, as opposed to the full lockdowns of the spring, that they work, that they do enough?
Look, I think we have a proxy for this in what happened during the summertime in the South, when you eventually had a population that became more vigilant, when there was a lot of spread and people started to decrease their mobility, and we saw Google mobility data start to decline. When we saw mask ordinances get into place and we saw policymakers take targeted mitigation steps to close things like bars and restaurants, you started to see cases decline. They didn't decline as rapidly as they did in the springtime when we had the full lockdowns in effect. But those are very costly socially, culturally, economically. They have big public health impacts. And so if we can start to reverse the tide of spread by doing these partial measures, these targeted mitigation, that's really what we should be trying to do right now. And then you can look at states like New York. What they do is they do very aggressive mitigation on a regional basis. So if they have an outbreak, they'll attack it very aggressively. That's caused some consternation in the state, but they've taken aggressive steps on a very localized basis. That's another way to try to deal with this. But we're going to have to eventually take some steps here to try to slow this spread, because the healthcare system is going to eventually get pressed.
Dr. Gottlieb, I wanted to ask about vaccines, and of course you're on the board of Pfizer. Earlier in the week, the CEO of Pfizer said that their vaccine was a game changer. I wondered whether you would use such strong words, or were you always expecting that at some point by late this year and widely available by middle of next year, we would have a vaccine that was very effective, i.e. great to have it confirmed, but largely one of the companies would come out with something like this?
Look, I think the data that we had, and it's interim data, so we have to acknowledge that this is early data. It's an interim analysis. I think the vaccine showed efficacy beyond what we were expecting. The benchmark for authorization or approval by FDA and the World Health Organization was about 50% effective. The trial was powered to detect an efficacy of around 60%. When you start to see more than 90% effectiveness in a clinical trial, that holds out the promise that the vaccine may be effective at preventing COVID disease, but it may also be effective at preventing transmission of the virus, or at least slowing transmission of the virus. Perhaps it's preventing some people from getting infected, and then when people do get infected, it reduces their chances that they're going to go on to infect other people. And if, in fact, the vaccine's able to affect transmission dynamics, it has more public health impact, because it could actually slow the epidemic or bring the epidemic to an end.
Shepard Smith here. Thanks for watching CNBC. on YouTube.